Hello, Dr. DMAC. This is Ivan Acosta from your PT2 class. We're going to do another 360 around the room. All right. I'm going to set you up for our next exercise. So this next exercise is going to be the half kneeling single arm overhead press. So we're going to start with the band first. But this exercise is targeting those humeral and scapular stabilizers that are giving us that overhead ability when we do overhead movements and upward scapular rotation as well as we're doing it. Some of the primary muscles that are being hit are the pectoralis major, the anterior deltoid, the triceps, and even the serratus anterior, and a little bit of the core stabilizers too as well. So for this exercise, I'm going to be using this just to simulate the band. So normally this would be behind. I'd have the doctor on the side here stepping on the band. But what we want to do is we want a patient kind of hook in, and we want to kind of simulate a kettlebell, as if the kettlebell is right behind and the weight would be right behind us. So when we press, we want to go straight up, punching through the ceiling. So that would be an external cue we can give our patients, is punch through the ceiling. So come straight up and come back down, up and down. Now we don't want to see our patients kind of flaring their elbow to come out. We also don't want to mimic an Arnold press either. We want to try to keep that as trying to keep it as kettlebell related and kind of tight right here as we press straight up and down. So we can also cross that into a dumbbell or kettlebell. So here's a dumbbell to kind of simulate it. So from here, same thing, coming straight up and then coming back down. So for this exercise, we want to use the strength rule of 15 to 25 reps. We can do this exercise bilaterally. So again, this is an exercise that is going to be used for those patients who struggle with overhead movement, especially those with anterior shoulder pain as well.